I'm Dr. Ramachandran, one of the orthopedic surgeons and the hand surgeon here at Logan, and this is Courtney, our excellent PA. And today we're going to have a little talk on hand and wrist pain. So these are little slides that introduce us. I'm trained in orthopedic surgery and hand and microvascular surgery. Courtney is a PA with special interest in orthopedic surgery. So today we're going to address the issues of common hand and wrist conditions. So there are numerous things that we see in the hand and wrist and arm. We see arthritis, bursitis, carpal tunnel syndrome, de Quervain's tendonitis, Dupuytren's contracture, finger fractures, masses and ganglions, stiffness in the hand, mallet deformities, nerve injuries. In the arm, we see golfer's elbow and tennis elbow, cubital tunnel syndrome, and then multiple fractures throughout the extremities. So what can we do? Well, here at Logan, we're really set up to do comprehensive type care for the upper extremity. We can do emergency treatment for minor and major injuries, including complex fractures, nerve injuries, artery injuries, tendon injuries. We have a surgical microscope. We can really address almost every kind of injury that you can think of. We can help restore function following disabling type injuries, work injuries like repetitive motion injuries, like carpal tunnel syndrome, cubital tunnel syndrome, trigger fingers are easily addressed. And then patients who are suffering from arthritis in the wrist, the fingers, the thumb, things that we commonly see and help improve function with. We also see lots of ganglions, tumors, and lesions. We can help with scars and scar revisions. We treat upper extremity conditions like de Quervain's, Dupuytren's contracture, tennis elbow, cartilage and ligament injuries, and we even have ability to do arthroscopy of the wrist and small joints. So, whenever we evaluate a patient, what's the most important thing? We need to get a great diagnosis. Courtney?
So the two biggest parts when we come in to get a new diagnosis is a good history and physical exam. So when someone comes in, we just sit down and have a conversation. When did your pain start? What type of pain are you having? How long has it been going on? A lot of times we can actually hone in and pick up on that diagnosis just from the words that you guys tell us in your history. Coupled with a good history is a good physical exam. In every specialty it's very important, but I think in orthopedics even more so, just because of the type of injuries that we're dealing with. Really putting our hands on the patient and talking with them, kind of seeing what gives them pain, what makes them feel better. With the history and the physical exam, we really come to a good diagnosis at that point. Now the next thing that we do is order any type of augments to that, such as x-rays, other imaging studies such as CT or MRI. We also order something called a nerve conduction study, which is essentially a roadmap of the nerves in your upper extremities. So what that tells us is if you have compression at the neck, elbow, or the wrist. A lot of times we'll order that if we think anyone has any type of carpal tunnel or cubital tunnel or any type of nerve-related injury. Another thing that's not listed up there, but is also important, especially in a new patient who comes in with any type of arthritic or inflammatory conditions, are labs. It's a good thing to order those labs, really kind of hone in, with rheumatoid, osteoarthritis, things like that. So we order those as well. Now, once we come to a good diagnosis, we've ordered all of our testing. First thing we want to go through are non-surgical treatment options. So there's a couple different treatment options up here that are non-surgical, so I'll kind of go through those with you. Probably one of the most hard for most people is just simply rest. A lot of times taking time out of your schedule, taking time out of work, your normal activities is really taking time to rest that area that's giving you problems and really take time to do that. I know for myself that's probably the hardest when I have to do that, so I think for a lot of patients that's the case as well. Other things that we utilize are splinting and casting. We do those in the office as well. A lot of times with about 4 weeks of splinting or casting, we can actually manage most of the fractures that we get in the office. Another non-surgical option that we have is medication, obviously oral medication. So whether that be corticosteroids or anti-inflammatories, Both of those medications really will decrease some of your pain as well as inflammation. There are some patients that have some contraindications to those medications, so we go over that in the office when we talk and kind of look at your medical history. Another thing that we utilize as a non-surgical option are our injections. Whether that be in the joint or specific area on the hand, they go right in that focused area and give you a lot of pain relief. So we do those in the office. And a lot of times that produces pretty good results. We get about a week's worth, and people usually start feeling better with that. Now, one of the other non-surgical treatment options we have are physical or occupational therapy. Now, in my opinion, I think this is one of the most vital for a lot of our patients. Once again, I think it's sometimes with people's schedules the most difficult to utilize, but I really think that one-on-one treatment with the therapist, whether it be occupational or physical, really gives good results. A lot of times when we utilize that as a non-surgical option, people come in after a couple weeks of therapy and they look like new people. They feel much better and they're doing well, and we didn't even have to go to surgery. So, and one thing to note here, so these are our non-surgical options. A lot of times 80 to 90% of the patients that come into our office will get better with just these options without ever having to go to surgery. So I know there's kind of a little bit of an intimidation factor when you go in, you're like, oh, I'm seeing an orthopedic surgeon, you know, they're probably going to want to do surgery. It's not necessarily the case. If we can do these non-surgical options first and get you better, then we can keep you from having to have that further treatment.
So surgical treatments. Well, you know, if non-surgical treatments fail, then we have surgical treatments that are available. And we're going to go over 5 different ones that we commonly see tonight. There's carpal tunnel syndrome, trigger fingers, thumb-based osteoarthritis, finger joint osteoarthritis, and Dupuytren's contracture. In carpal tunnel syndrome, patients present with symptoms and complaints of numbness, tingling, waking at nighttime with numbness, clumsiness of their hands, and frequently they complain of a distribution of numbness in their hands that includes the thumb, the index, and the long digit on the front side of their hand. If conservative treatment fails, then surgical treatment is actually very small incision, and it usually only lasts about 7 minutes. So people are like expecting these long surgeries. Actually, it's not that at all. And the recovery from this gives patients great functional recovery with really improved symptoms. And most of our patients are very, very pleased with the fact that they went and got this done instead of sitting on this for years and years. Trigger fingers. In trigger fingers, patients get a thickening of their A1 pulley, and this results in a painful catching or popping of their tendon when they flex and extend their finger. This is one of the most common causes of hand pain and disability, especially in the working force. Again, when conservative treatment fails, surgical treatment with a tiny incision, 3 minutes of surgery, can yield really good results almost immediately, and patients are relieved from their pain and suffering. Thumb-based osteoarthritis. This is the most common site of osteoarthritis in the entire body. People think of knees and hips and getting osteoarthritis. The thumbs are the ones that give you the most amount of osteoarthritis statistically. A lot of people have this hump deformity on their base of their thumb, and it becomes very painful to pinch and hold and grip with your hands. And if you can't do that, then it becomes very difficult to work. This x-ray shows the bone-on-bone nature of that osteoarthritis, where the 2 bones in your thumb are grinding against each other, and that helps generate the severe pain that patients complain of. For this, we have multiple different surgeries that are available, but one of the most elegant ones is this joint replacement, which is all natural. It uses half of a tendon that's within your own body, and we suspend the thumb to the index finger and remove the arthritic segment, and that results in no more pain as well as really good range of motion. And patients are very happy with this type of procedure. Finger joint osteoarthritis. I'm not sure if you can see it from where you're sitting, but here in this joint here, the metacarpal phalangeal joint, again, you have bone-on-bone arthritis. And with that, that can give significant pain with gripping and holding and this can lead to a lot of morbidity. And for this, we have both silicone and pyrocarbon type implants that are available. It's kind of like a mini knee replacement, which you can do in a finger. And this can get rid of pain and suffering and make people more productive. Finally, Dupuytren's contracture. This is not really a disease, but is more a genetic condition where you have a connection to the northern Scandinavians in your genetic lineage, and you form these cords in your hand which draw your fingers into your palm over time. And this can be very disabling, and you may see little old ladies out there with fingers that are curled up in their hands, and that's what they have. And again, this is something that, once diagnosed, can be treated surgically or even non-surgically, where we can remove the cords and give much better function to the hands.
So the big question is, should you wait? So we always want you guys to assess your pain and ability to function at home. There's a couple questions we always have you guys ask yourself as you're kind of going through these problems. And these are some of them listed up here. Do you have any difficulty sleeping or performing basic functions? So if you're doing any type of normal movements that you usually do, and over time you're starting to realize, well, man, that's really starting to bother me, or that wasn't as bad as it was before, those type of things. So if you're answering yes to that, it's probably a good indication that you just need to come in, get evaluated and see if we can't come up with a treatment plan for you. Another question we utilize is, does medication no longer provide relief? Sometimes people will get started on a medicine, be doing really well, and then over time they start to realize, my pain's coming back quicker, doesn't seem to be lasting as long. And if that's happening, it's probably a good indication that, one, your problem could be getting more severe, so you probably need to get checked on, or two, there are other medications we can distribute to help you with your pain. You just may need a different medication. I think one of the biggest questions we utilize in the office is your quality of life being affected? If you're really starting to feel like, you're doing things and you're having more pain, you're working out in the garden, you're realizing, man, I can't do that anymore, or you're running around with your grandkids, you can't do that as much anymore. If you're starting to feel that way, there are things we can do to help you. I know it's sometimes difficult to really admit that to yourself, but coming into the office and just talking about it, getting a game plan together, doesn't have to be surgical, but we can all work together to create a good treatment plan for you that'll make you happy and let you do the things you like to do. So, like I said, if you're answering yes to any of those questions, it's probably a good idea to just call, make an appointment, come in and talk with us. I always tell people, there's never going to be any harm in just talking about it. You don't have to do anything. You don't have to make any decisions right away. But it's something we can talk about and kind of create a good plan for you guys. Two things to note here. Early diagnosis and treatment are very important. A lot of times what I see in the office is we get people who have struggled with pain, whether it be hip, knee, hand pain, for years. They're too busy. They don't like the doctor. They don't want to come in. COVID's kind of thrown a big wrench in all of that as well. But a lot of times they've been suffering for so long, and their symptoms or their pain is so severe that there's only a few select treatment options that we can give at that time. So we always encourage people, when they're having symptoms, come in. Early diagnosis, getting you started right away, it's really going to give us the most treatment options for you and get you feeling better quicker. Another point here, especially in the older population, osteoarthritis is degenerative. What that means is, after someone is diagnosed with osteoarthritis, that's not going to ever be taken away. But what we can do is manage your symptoms, get you feeling better, and get you on a treatment plan that lets you do what you want to do with minimal to no pain.
So, assessing this pain. These are some of the questions you want to ask yourself. Do you experience pain or discomfort from your injured hand or wrist? How often do you have pain in your injured hand or wrist? Do you have pain at nighttime? Do you have pain at the end of a day's work? Does your wrist feel stiff in the morning? Do you have problems with wrist movement? Do you have problems carrying things? Do you have problems performing manual work with your arms? When you consider pain, it's good to be able to rate your pain. make a scale in your mind from 1 to 10 and say, what number represents where I am at pain level? And if your pain level is greater than 4 or 5, it's probably something that is affecting your quality of life. And it's probably something that you should get a little bit of education on as to what's causing this pain and what are the things that we can do to help that. And with that information, you can make choices as to what you want to do. Do you want to address it? Is it something that is in sync with your lifestyle and something that will make your quality of life better? And that's what we're here for, and those are the things that we can do to help. So questions. So, tonight we wanted to kind of introduce some of these topics to everybody, but more importantly than that, I wanted to introduce our amazing staff who has helped us build the kind of practice that we have. And some of them are sitting right here. They're the ones who actually make this whole engine work and help us be able to do any of the things that we do. So they're both here tonight. Why don't you guys stand up? And without their amazing help, it's difficult to be able to do any of these things or address any of these big problems. So I'm glad we were able to have them all together for us. Any questions? We can field questions about this or any other kind of orthopedic questions, hand surgery questions, anything that you like to talk about. And we also have some brochures and pamphlets on specific orthopedic topics outside that you're free to take. Or if you want us to come over and talk about any of these other conditions, we're happy to do that.
I do have a question about, so a joint replacement in your hand, how much strength do you get back? You know what I mean? Is there...
Well, most of the time when you're having that severe osteoarthritis in your hand, you have either had trauma to your hand or it's age-related where it's from wear and tear over extended periods of time. So the biggest goal is to recreate your ability to have range of motion, because most of these people have completely lost their range of motion. Grip strength and things like that, a lot of times you'll have to sacrifice because when you're putting implants like that into the hand, you're not going to be able to get your 100-pound grip strength back. But at least you'll be able to move your hand and have productive use of your hand. So you do have situations where you may not just like getting a knee replacement. You're not supposed to run on a knee replacement, but you can walk on a knee replacement. And so patients are usually looking to be able to walk and not actually become an athlete again. So there are some limitations, but it does improve that quality of life from that severe pain that most people have had before they consider that. Other questions? Well, thanks for coming out tonight, and we'll be around if you want to ask any other questions. It was great to have you guys here.